have also quite increased, over 2,000, which is not a very good thing to celebrate. But with me today is quite a very good and experienced panel, the people who are going to help us understand what we've been doing in the communities to try and flatten the curve of COVID-19 through various ways, especially behavioral change, because COVID-19 has really been understood to be a behavioral change infection before they can do anything about it. So with me in studio, I have Joanita Menya, the CEO, Unilever Uganda Limited. And we do understand that Unilever has been spearheading the behavioral change campaign globally. So Uganda also gets to benefit from what Unilever has been spearheading. And we will have some people online, including engineer Dr. Samuel Motono, the advisory council member at AmRef Health Africa, and he will join us later at about 4:30 p.m. We'll have Martha Naigaga, Maureen Nankanja from AmRef Steel, the monitoring and evaluation country manager. We have Comfort Hajra Mukasa, program manager, still AmRef Health Africa in Uganda. We will speak to the district health officer for Choltera, because it is one of the districts where this program was implemented, Eduardo Muhanga. He will be joining us later online. We will also speak to Dr. Luis Nyende, the district medical officer in charge of Makindye division, where the program also was implemented. And we will have Martin Mochanga, the director WASH at AmRef Health Africa. We'll have Maggie Rayere, team leader, National Business Compact on COVID-19. So the people you don't see here in studio will be joining us later online. And to start it off, I want to hear from Comfort about the behavioral change program and the objectives of the campaign. What have you realized so far?
Thank you very much, Walter. Good afternoon, viewers. Thank you all for tuning in. My name is Comfort Hajra Mukasa. I manage water sanitation and hygiene programs for AmRef Health Africa in Uganda. AmRef Health Africa is the largest international NGO that was founded in Africa for Africans. Our sole purpose of existence is to create a lasting health change in Africa. And AmRef was founded in 1957, but the government of Uganda invited us to come in Uganda in 1987. So we've been in Uganda for over 30 years, doing water sanitation and hygiene implementations, but alongside other health programs, because we're a comprehensive health organization. Now, like you said, at the peak of COVID-19, and when we discovered, when COVID-19 was the first case was first detected in this country, AmRef Health Africa in Uganda, with support from DFID and Unilever, we came up with the idea of complementing government efforts, but through a social behavior change campaign. Yeah. And the objective was to try and get to people to partner with them to contribute to the control and prevention, but basically targeting behavior change amongst the people. Yeah. This program drew a lot of strength from partnership with government. We had a very good partnership with Kampala District, Kampala City Council Authority. They don't qualify to be called a district. Working with the division medical officers, the health inspectorate team, the Weyonje team. We also drew a lot of support from the communities. In as much as Unilever and DFID made investments that supplied hardware facilities to communities like hand washing facilities, emergency hand and hygiene supplies, the communities also made a lot of investment in their own hygiene facilities. And so the objective was to have people change behavior, which would result into the control and prevention of further spread of COVID-19, thereby restoring back life to normal. Yeah. But today we're here because in addition to what we've realized, we want to advocate for rapid scale and transformation of the existing WASH policies to help us respond better to the current situation, but also prepare for further public health epidemics. We also want to share findings from the rapid assessment that we did with the investment that we got from DFID and Unilever. We also want to all agree at the end of this discussion that actually water, sanitation and hygiene is the pivot to the control of COVID-19 and the recovery, moving towards to normal. Last but not least, we want to create a platform for other partners that are not AmRef, Unilever and DFID to amplify their voices and experiences in regard to COVID-19. So it's going to be both a presentation but also a learning session where we'll get to hear from what others have done.
All right.
Thank you.
Thank you very much. I know you have a presentation, or I don't know if you've squeezed everything within, but if you do have a presentation, please go ahead.
No, I don't have a presentation, but we have certain figures that we will share through Maureen. All
right, so at this point, Maureen, please, let's hear from you at the point of understanding the findings from the rapid assessment. This is a one-year project. It's coming to a conclusion. What did you find?
Good afternoon, Walter. Thank you so much. Good afternoon, viewers. My name is Maureen Nankanjalias, Country M&E Manager. At the start of this project, we conducted a baseline to establish the performance of the different indicators. Mainly, these indicators were looking at the knowledge, attitude, and practices that point towards COVID-19. It was a CAP study. So there are those key indicators we really looked at. One was access to hand washing facilities. We went through the different divisions within Kampala and Choltera. We sampled the households. And at the start of the project, 48% of the households had hand washing facilities. These were put at a latrine or within the compound. But as the project progressed within the last month, we've seen an improvement to 54.7 households. We have new households that have installed hand washing facilities. We also went ahead to look at evidence of using the hand washing facilities. You know, it is one thing to have a hand washing facility next to your latrine, but are you really using it? Yeah. So at baseline, 63% of those people that had hand washing facilities were really using them. But after some time, after our interventions, we've realized an increase to 91.6, because the VHTs have been moving in these households, emphasizing the need of hand washing, as opposed to having a hand washing facility without using it. So we've seen increase in utilization and usage of these hand washing facilities. The other components we looked at were the knowledge on spread and prevention of COVID. We looked at how do people know that they're supposed to avoid crowded places. At baseline, 13% didn't know. 13% were aware that they should avoid crowded places. So that shows that 87% of people in these districts were not aware that avoiding crowded places was a key method to prevent COVID. So we've seen an increase to 83.7%. So now this increase shows you that we are left with close to 17% of the population that need reinforcement to make sure that all people are aware to avoid crowded places. Then the other thing was hand washing as one of the key prevention methods. 29% knew that hand washing is key. Just imagine us having the whole 71% of our population not knowing that hand washing is core in prevention of COVID. Still with the intervention, hand washing practices have improved, but also knowing that it's supposed to be done has increased to 84% within these communities. The other, which was a little bit critical, was social distancing. People really enjoyed being together. People enjoyed, our society. 25% at that time of baseline really indicated that avoiding crowded places was, keeping social distance was a key prevention method. So the team, especially the community health workers, the VHTs who have done door-to-door sensitization, went ahead to train these households, and we've seen an improvement to 81%. The other contentious issue was wearing the mask. 30% knew that it is a core indicator, a core thing to prevent COVID. However, others didn't agree to it. But at the end of the project, we've seen an increment. It's 93%. And as we've kept on doing several CAP studies within the program, they were monthly. Mainly this was to help us understand where do we need to focus more. Or once you understand what is happening to the community, what people are saying. Yeah. So we thank the VHTs. They were really key in triggering the communities, but also focusing them to the core things that help in prevention of COVID. Thank you so much.
Okay. When you talk about these percentage figures, I like to break it down and make it easy for the person out there to understand that when you say 29% were unaware that social distancing is important, then it means 29 of every 100 people we shall count do not know. Yeah. That's quite a big number. But I'm interested in understanding the choice of districts that you used for your sample study. Why did you choose these districts? What was, special about them?
When you look at the project is focusing at what would call the high burden cities. That this is Kampala and Choltera. So even when we were sampling, we looked at households, but we spread the sample across the divisions in Kampala. Same applies to the sub-counties in Choltera, so that we have equal representation of what is happening within the different locations. So that's how we looked at the sample sizes.
Okay. You want to intervene?
Yes, thank you. I wanted to also, first of all, what informed our choices of districts of intervention was also something. Because at that time, Kampala is the the key district of that business will happen. It's one place that draws in people from all walks of life. So even at the peak of COVID-19 in Uganda, Kampala suffered. Even right now, we know Kampala has been hit the worst. But then Choltera, we chose Choltera because, Choltera is a key border where it's one country there's this contentious issue about COVID in Tanzania versus Uganda. And so we chose Choltera district and also Mutukula, but also Nangoma, a key sub-county where it's hard to reach, hard to stay, and also hard to get services. So we chose these locations because we really wanted to complement what government was already doing to try and contain the COVID-19 in the country. And we were so aware of what was ahead of us, but we still knew that if we partnered with the communities and both unlocked their potential, then we're able to create change together with these communities.
Okay, so let's pause the discussion here a bit and take a look at this story that I did about 3 months ago. And of course, the lockdown was already lifted, business had resumed to normal, and the campaign that we are talking about right now, behavior change, was being implemented in the districts of Choltera and Kampala. Now, when we visited Choltera, of course, we went to the extreme until the islands. We still found some challenges. For example, the hand washing facilities were not enough. AmRef had really tried its best, but they were not enough, especially for schools, with very many children. And all these challenges were documented. Take a look at this story, aired the first time in April, but we are running it today for you to see what we're actually talking about. Take a look.
COVID-19 is still around us, despite the fact that the numbers of new infections and those in hospital have gone down. With the need to restore livelihoods, relaxing the lockdown measures was inevitable, and now learners are returning to school in a staggered manner. Working with different partner organizations, government has embarked on behavioral change campaigns to ensure that people continue to embrace COVID-19 prevention practices. In Choltera district, government is working with AmRef Health Africa to implement the social and behavior change program interventions in fighting COVID-19.
They have given us an opportunity to engage the parents by making use of us, the available resources, the COVID task force of the district and the medical department. They have been sponsoring programs on the radio.
We are here to sensitize and teach science teachers on key aspects of prevention of COVID, hand washing, hygiene, body hygiene. We have issues to do with behavior change. So we look at the children being key changing agents in the community.
The beneficiaries from the partnership, teachers and village health teams are being trained on the best practices to prevent the spread of COVID-19. The groups are then expected to transfer the knowledge to the communities.
We normally have guidance and counseling sessions. There now we shall bring in this hygiene and sanitation at school, then at home, because if you say a latrine at school, how do we manage a latrine, or how do we clean a latrine at our homes, even at school? If we are to provide a hand washing facility at school, how is it being done at home?
For many schools across the country, compliance with the Ministry of Health standard operating procedures in prevention to COVID-19 will remain an uphill task, largely due to challenges beyond their limits, including the complacent communities around them and limited resources.
For instance, if it was to be proper social distancing, we must have single-seater desks or tables. But those are very few. We have very few schools which have those single-seaters. Then you look at the classrooms themselves. We used to have 50, 60, even 70 children in the class. But with the social distance of 2 meters of one desk from another, you find a would-be class for 60 now takes only 15 to 20 children.
For those at the border points like Kasensero, access to basic things like information is quite difficult.
Tutambulira ku bulumi nnyo ekisooka wano bannannyini maato batusasuza nga bwe baagala. Era bwe tutuuka eyo Kasensero nabo bannannyini motoka nabo ne batusasuza nga bwe baagala. Okuva lwe baawulira nti ekirwadde kigenze kikendeera era nabo ne bakyusaamu obutambala masiki.
The AmRef partnership will end this month, and therefore government is expected to find new ways of continuing the work done thus far or let the effort slide away into oblivion. Walter Mwesi J.
Okay, so that story basically painted a picture then. Now things have changed. We are now into another lockdown, and we will have to almost start over again. Some of the things that we pick from that story is lack of information, and you did also mention in your statistics. At this point, from your statistics, what areas do you think that we need to focus on this time after, as we get back to normalcy? We probably hope that the lockdown will be lifted on the 29th, but what areas do we need to focus on?
Thank you, Walter. One of the key areas where we need to focus is wearing of masks, because we see, people tend to drop the habit after some time. So we need to keep emphasizing putting on the masks, but also the hand washing itself. This is something we've been learning from childhood, but as we grow, we tend to drop it. So this is where we need continuous effort, continuous reminders to the communities to adhere to hand washing, to make sure that it's done when it's supposed to be done and in the right way. Thank you so much.
Okay. I now want to hear from Juanita. The global campaign about behavioral change. What prompted this campaign, and what have you realized so far?
Thank you so much, Walter. Good evening, viewers. And I think from a Unilever perspective, globally and in Uganda, we may know that our vision is to have sustainable living a commonplace. So for us to achieve that vision, when I say sustainable living, many things come into perspective, including your health, including water, because if you want anything sustainable, water is a must-have. So when AmRef approached us, it was, we just synced because we had this vision, trying to make sustainable living commonplace. But what we do with that, why we had to get into bed with AmRef for this particular one, was because AmRef was at the community. So you can't make sustainable living commonplace without the community, because it's the people that make it commonplace. So when AmRef came through with the program on sanitation, being the largest soap provider, as you know, Lifebuoy is the biggest antibacterial soap in the world, we had an obligation to step in and support this initiative. We've had many other initiatives in the world with other partners, and when you come closer home to Uganda, we understand that when you want to make anything commonplace, you start with making it a habit. It should come as naturally as possible. And we started that campaign many years ago. Unfortunately, COVID stopped it at some point. But we started a campaign called Clean Ninjas with the children. Yeah. Again, with Lifebuoy, teaching or hand washing, putting up hand washing points in schools and the likes. Because the children are such an important factor in this journey of making habits commonplace. Because if you are to make sustainable living commonplace, then we need to make habits of certain things, like hand washing, like, you know, when are the occasions of hand washing. So if we talk to the children will influence the older people, because it's harder to speak to the older people to change their mindset. But a child is still open to change. So this for us was a critical moment, because for us COVID is a behavior issue. Yeah. If we just made hand washing commonplace in Uganda, in Africa, in the world, COVID will be out of the window. And I think we can even consider getting the masks off, because that's not us. Naturally, human beings would like to interact. I mean, I feel uncomfortable speaking in the mask, but it is what it is. But if we were sure that everyone understands why they need to wash hands, understands why they need, I'll give you an interesting statistic. For us to manage the COVID crisis, we teach people to wash hands with soap. But I can tell you that right now, the ideal hand washing statistic that should be, you know, normal with hand washing, it's that people, about 1 million people, should use at least 1 ton of soap. Yeah. Right now, about 1 million people use 8 bars of soap. So you can imagine what the challenge ahead for us is. Yeah. 1 ton versus 8 bars. Yeah. And we are talking people, including mothers who handle children's food and the like, yeah, because there are people who really come close to health that need to understand this. So we have 3 challenges ahead of us. Number 1, education. We need to educate people. And where do we start education? I would like every partner, because I think it can't be Unilever and AmRef alone. I would really invite more partners to, because this is a battle. We are fighting. We are on a battlefield. I would like to invite more partners. Can we handle what we teach the children and what we want them to learn? Number 2, can we try and avail affordable product and make it available wherever we can? Yeah, and I think that is the challenge Unilever is trying to address with all the soap and the sanitizers and all these things. How affordable are they? How available are they? Because they can be affordable, but are not in the places where the people are. How can we get working route to market to make sure someone, a gombola, somebody in choltera, deep in the village, can actually get access to a bar of soap? Yeah, so those are things that I would really encourage partners who I really urge to come on board to think about. From a private sector's place and a global place, how do we make good product? How do we make it affordable? How do we get the children on board to start the habits at that end? So if we can do that together, then we're in business. But for now, the journey is still long.
Okay, so we have the District Health Officer for Choltera District, Dr. Eduardo Muhanga. Doctor, if you can hear us very clearly, I want you to, give us a brief. First of all, your district was a hotspot for COVID-19 when we had the outbreak and we were at the peak. And when we visited, some of the challenges there was that you are a border district and there is cross-infection from TZ and all the other neighbors around there. But what is the progress so far, and how did you benefit from this behavior change campaign? Doctor, you need to unmute your microphone so we can hear you. Okay, so as he tries to work out his microphone, we will get back to him. But Joanita, I still wanted to come to you because you are talking about a very important issue to do with resources. And you've mentioned soap as number one, but also water. But what other resources do we need to prioritize for the communities for this policy to be achieved? You know, this behavior change campaign to be achieved, in that even when AmRef or Unilever, you know, have long gone, it will still be maintained in our communities.
Yeah, thank you very much, Walter. So in terms of resources, I think, like I indicated, one of the major factors which we have been struggling with is mindset. Yeah, which we will only change by reiterating the message as consistently as we can. And I think I'm glad that we are at a media house because you have a big role to play. Yeah, so communication. Yeah, yeah. How do we educate our people that this is what we need to do? So the media comes in handy to get us to those places and make them understand what we are saying. So there's a lot of communication material required: print, non-print, social media, information. Yeah, so there's a lot of information required in that space. Then there's a lot of people resources. Yeah, because when you go deeper into those villages, you'll be surprised how inaccessible phones are. Yeah, so how do we get to those people who have not yet gotten to the level of phones? We have information on data on phones, we have information on, you know, internet. What about those people? So we need people resources, people who are willing to go down there, teach, you know, one by one, as in the basics. From the basics, this is how we wash. One of the reading material that we have that we were giving out in schools is 5 steps of hand washing. Yeah, as basic as that. But people do not know how to wash hands. Yeah, they may have the soap, they may have the water, but they don't know how to wash hands. How do we then teach them that piece? So a lot of training and information needs to go out there, but needs to go in the right package, because you don't expect to give someone information in the village on the internet. Yeah, so you may need to print out Luganda or native language information, flyers and the like. So a lot of information, that's another piece that we need to put together. And how then do we disseminate it to the people? So that's how the media piece also needs to come in place.
Okay, all right, thank you very much. The conversation is going online, and if you'd like to follow and probably make a comment or ask a question for any of the panelists here or anybody online, you can use the hashtag WASH, capital letters, and first, F capital, and the rest small letters. That's hashtag WASH first. WASH and F in capital letters. Ask your question. We will be able to sample some of them in the next hour, and you'll get your responses. And we will also be joined by our colleagues on the other side from Kenya to give us a perspective of what is happening in Kenya. We will link to Dr. Muhanga as soon as he gets back. Doctor, your microphone probably is now set. You can now tell us. I'd asked you earlier to, give us a brief of what your district situation or COVID analysis is now, and how the district benefited from the WASH campaign.
Thank you, moderator. Good evening, all our viewers. I'm Dr. Eduardo Muhanga, the District Health Officer, choltera. I'm happy to be part of this program. First and foremost, I want to appreciate AmRef for the support they have provided to the choltera district, most especially during this COVID pandemic. Choltera district is a border district with Tanzania, and Tanzania, who is our neighbor, has chosen a different strategy when it comes to its response of COVID-19. That means it puts a great danger to the district. So we as the district had to be very vigilant to see that there are no cases that are coming from the border, because as we talk, choltera district has 4 sub-counties that are bordering with Tanzania: Nangoma, Kasensero, Mutukula, and Kakuto. So, being that the other side of Tanzania, they are not responding to COVID-19, it had put a high risk to choltera district. That is when, that's where we welcomed this project of AmRef, the HPCC program, we all know we've started identifying positive cases of choltera, positive cases of COVID-19 way back in March. And on a daily basis, we are getting around over 20 cases. But when AmRef came in, things changed in a positive direction. We saw the reduction of the COVID cases in the district, and this was because of the project. People at the borders, at Mutukula, at Nangoma, because of this project, they had been educated and they started hand washing. Also, the hand washing facilities were provided almost in all institutions, public institutions, schools, health centers, and also the VHTs were brought on board. They had to move from door to door, educating people the importance of good hygiene, hand hygiene. So we as choltera, we've benefited from that project. First, we saw the reduction in what? The reduction in the COVID cases. And also, we found out that even the diarrheal diseases that were disturbing people in those areas where this project was implemented, we also saw a reduction. And that was because people were hand washing and also social distancing, etc. Now for the second wave, that is where the challenge is, because as we speak, we've been witnessing high cases of COVID in choltera. But we think if this project continues in that direction, we shall have a reduction in these cases. And the good thing now, our people are getting used to the hand hygiene. Now, those days before the project came in, you could hardly get a homestead where there is a hand washing. But this time, at least very many homesteads are having hand washing facilities, schools, health centers, and also people are putting on masks. So my appeal is to the project coordinators is that we as the district choltera, we still need your presence such that we can respond more to this second wave, but at the same time, also continue educating the communities and also institutions. Good enough, we've seen the local government now coming up with strategies how they can, how we can, in case the project is stopped, how we can maintain a few of the activities of that project. And this is, we've tried to see that in all our budgets, there is a facility budgets, sub-county budgets, at least hand washing facilities, masks have been budgeted to see that at least we combat COVID-19 in the district. I thank you.
All right, Doctor, I also know that, you know, getting the benefits out of such a campaign is, you know, a combination of many things, including wearing masks like you talked about, social distancing, and basically having information on how to control, prevent the spread of the COVID-19 infection. But also talk about hitting two birds with one stone, the other diarrheal diseases also taking a slump, which is a good thing for the country. But we have seen statistics here saying that up to 30 people, at least in every 100 you will sample, do not know that social distancing is key. What is it like in Choltera district? We ran a story here where we saw that schools have a challenge when it comes to social distancing. How is this going to be handled as we also plan to probably ease the lockdown?
Thank you. I think members, it's not that we are going to combat COVID-19 in one day. Yes, there could be some people who haven't yet got that message how important hand washing or social distancing is in our struggle for in our response on the COVID pandemic. But I think if we are to continue with this project, we shall be able to increase on that number such that most of the people in the district get to know the importance of hand washing, social distancing, and also putting on a mask. So it is not one-day activity. So we need to continue in that direction. I thank you.
When you talk about, for example, sharing information, how is this being done in Choltera? We would like to hear from you. How are you ensuring that people there get information about preventing or controlling the spread of COVID-19? Because we had, for example, that some people cannot access or have no access to mobile phones. We went to Kasensero, where they have not seen anything like a material that has information on how to handle COVID-19, be it a patient, be it a rumor. How are you working to ensure that information is given to the public there in Choltera district?
Thank you. With support from AmRef, the district task force has been able to go to radios and TV stations to ensure that people get the message of COVID prevention. But at the same time, we've been able to distribute IEC materials to these places. At first, the IEC materials we had were in English and people couldn't understand them. That's when AmRef came in and they had to do some translations such that people can get the message. At the same time, we've been, before the second lockdown, we used to pass on messages to the mosques, churches, such that people who attend, however few they may be, are able to get some message on COVID-19 prevention in the district. So far, that is how we've been moving as a district on passing on the message to the people.
Well, Doctor, we will come back to you later. Let me get back to studio, and we're also trying to link to our colleagues who are on the other side in Kenya, but also the DHO of Makindye division here to see how Kampala is handling, because Kampala is still a hotspot. It hasn't changed, even when this information is widely spread here in the city. What could be the problem, by the way? Let's first understand from you, Comfort. What do you find the challenge in Kampala?
Thank you very much. Kampala has got both structural challenges and social challenges. When you look at the settlement pattern in Kampala, like go to the informal settlements in Kampala, it's even practically impossible to practice social distance because even your neighbor is hardly a meter away from you. Like, you know, those buses settlements, those settlements that look like buses. So we have a challenge of both structure settlement, and another challenge that we have is the means of survival in Kampala. Whereas someone up country in Choltera can go to the garden or find other alternative means of surviving, in Kampala, most people have to trade. It's informal trade. Like I have to trade, I have to put up something small. That's my cardinal way of survival. So now someone has to pick a choice between dying of hunger or dying of COVID-19. Yeah. So it becomes very difficult for someone to adhere to the COVID-19 standard operating procedures. Because if I have to stay home and not access town, then what's going to happen? My children are going to die of hunger. So I have to make a choice, either to risk dying of COVID-19 or die of hunger. But also other approaches that work well in Choltera, like the DHO was talking about, working through leadership structures. In Kampala, our experience is the degree of socialism in Kampala is way lesser than the degree of socialism in Choltera. Whereas in Choltera, it's easy to form clusters and have a cluster head who coordinates all households. In Kampala, we found a challenge that one person cannot dictate what happens in the next door. So even social structures that help to coordinate COVID-19 activities in Kampala is a problem. So it's a complex of problems and not just one problem that requires a comprehensive approach to unlock.
Everybody needs to be involved, and we do know that the village health teams, or VHTs, as you know, we commonly know them, have been playing quite an important role in spreading this information in our villages. Now, I want you to take a look at this video. This is a village health team member from Choltera district who has been doing a lot of work to try and spread the information that we ought to know about preventing and controlling the infection of COVID-19. Take a look at this video, and we will be back with Martin Muchangi, the Director of WASH Program at AmRef Health Africa headquarters in Nairobi, who is joining us online.
AmRef Uganda, thank you very much. We really do not have a word. As part of sanitation, the AmRef has empowered our VHTs, and you know those VHTs, they are the backbone at the grassroots. They are the very ones who can go to the ground, and AmRef has done the empowerment of our VHTs. Thank you very much.
Social distance tugira nti ebadde tambula bulungi tuzze okubayozayoza n'okubongeramu amaanyi okubeera nti munaaba mu ngalo ne sabbuuni.
Gano gonna maanyi ga AmRef kye kitongole kyokka era ekisinga okulaba nti buli ebitundu byaffe nga kawempe tutambula mu bantu nga tubabuulira enjiri eno nti munabe ne sabbuuni, abantu mubeere nga muli bayonjo. Tufunye ekifaananyi nti ddala tuli basawo ba ku kyalo be bayita ba VHTs, village health team, era nga tiimu yaffe neefuuse y'amaanyi, era bwe tutambula nga tuli wamu abantu baffe bano bongera okumanya nti ensonga tugikkaatiriza nti COVID-19 ono y'engeri yokka gye tuyinza okutambuliramu nga twekuuma nga tunaaba mu ngalo ne sabbuuni ne sanitayiza. Era neebaza AmRef okubeera nti empower.
Okay, so that is the work of the village health teams, and of course the gentleman in there who was telling us, you know, some of the things they go through. We will come back to the village health teams, but I want us to now join Martin Muchanga, the Director of WASH Program at AmRef Health Africa, Muchangi, yes, who is in Nairobi. And Martin, your role is on the importance of the WASH Program to the COVID-19 response and recovery strategy. How do you see this matching with what the community is doing and what we are trying to, you know, communicate out there? How is it working?
So thank you so much for having me here. And I just want to say that the problem which you are facing in Uganda is the same kind of a problem that we are having here in Kenya. So we are united together in this trouble, and I'm very sure joining our hands, thinking through together, we are going to come out of it even stronger. So very nice. You asked me a very nice question around the reflections of what WASH can do to help us to get out of this pandemic. I don't want to repeat what has been spoken around the issue of hand washing, but then I want to look at it from the entirety that if you provide water, sanitation, and hygiene, in general, you are empowering the communities. And I want to appreciate the fact that COVID-19 itself has made people to really get into a lot of trouble, failing to access basic services. For example, those people who maybe lost jobs, it is becoming very difficult for them to sustain the bills and be able to afford what they could afford earlier on. So this is what I think around what needs to happen so that, first of all, we access the services to the people, and we access them sustainably. The first thing is the government investment to make sure that those services are taken to the level which they were and surpass that level. And we need to think a little bit broader here because we cannot rely on the government alone. We need to bring in the private sector players to ensure that, the investment is accelerated and we are able to move with the speed that we desire. The second thing which I want to speak to is engaging the community and engaging the community in a meaningful manner so that, first of all, they get the knowledge, they appreciate it, and they become co-investors and protectors of those investments, either softwares or the hardware. So I look at it from that perspective, and I see it from a system point of view that if we advance war services, then in a big way, we will be able to be resilient to COVID-19 pandemic. So thank you.
All right, Martin, also to hear from you about, some figures and how you're handling. We had here in the country studies that were conducted. Quite a number of people, up to 30% still did not know that social distancing is key. 17%, did not know about washing hands, and 70% didn't know, about things like masks. Such statistics, show that we still have a big task ahead of us, even when we are trying to figure through what to do exactly, finding vaccines and, having them given to the people who require to have them at this point. But what is it like in Kenya?
Good, thank you. The situation is somehow similar to Uganda, and I think it's across Africa. So to begin with, the lack of information or in pandemics, wrong information being passed to people is somehow a common thing. It's a common thing across the continent and especially in Kenya as well. But it's something which I would want to speak to because these are some of the things which we've innovatively advanced. The first thing is to understand who you are communicating to. So segmenting the communities, understanding various segments of communities, whether it is by age, it is by gender, by community, by ethnicity, and then crafting messages that are able to speak to those communities, and using the medium that is able to reach those communities in the best way possible. So, for example, if you want to target the youth, we found that if you are using social media, and here in Kenya, social media is quite common, you are able to reach as many as possible. If you're using cartoons, if you're using puppetry, you are able to reach the young children, and actually they're able to sing the song, form a social norm, and observe handwashing. So, in short, I would say that whereas, yes, we do have a challenge right now, we need to think moving forward what innovative ideas and systems we can put in place to make sure that information is properly transmitted. And then number two, it is assimilated within a whole system approach. So yeah, thank you.
We still have challenges to key resources, and here the discussion in studio, some of the issues that were raised to that effect was access to water. I've seen statistics from Kenya here. You have at least 29% of people in Kenya who have access to improved sanitation facilities, which is quite a good thing, better than our country here statistically. Is this impacting how COVID-19 is being handled there?
Yes, and if we do nothing, or if we do business as usual, it will take Kenya 200 years to achieve universal sanitation coverage, and it will take Kenya 60 years to achieve universal water coverage. So the thing is, and I spoke about it, we need to do things differently and in a manner that we can change that curve of growth. And this is what I would propose. The government is the policy holder. But the government being the policy holder and the key investor, we need a framework that then can attract different form of investment from individuals, that is private, from businesses, from institutional donor, and putting all that in one basket and within a framework which is properly calculated to ensure that whoever is lacking and regardless of whichever socioeconomic status they occupy, they are able to access that service, whether it is water or sanitation, and sustainably. So there are different methods that AmRef is using to promote that, but the baseline is, in whatever we do it for the purpose of ensuring that each and every person gets health. So we do it as a human, we do health as a human right. So whatever we do, we try to make sure that we are advancing health to the people, and we do it in a sustainable manner and putting all the stakeholders into the table to work a journey that is sustainable. So yeah, thank you.
All right, thank you, Martin, and please stay on. We will be coming back to you shortly. Let's head back to the studio a bit. Before that, I want you to take a look at this video, and this video has, the key things that we need to do to prevent ourselves from contracting the disease, that is COVID-19, but also spreading it to our fellows. Take a look. So it's your duty to ensure that you do the right thing and not be, held accountable for someone else's death or, being hospitalized because you spread the infection to them and, they were in bad state. And probably you managed to survive it because we have learned now that COVID-19 affects us differently. Some will go away with a very severe disease. Others will go away with just mild symptoms. But don't be the reason COVID-19 will still move out there. At least from the health officials, the Ministry of Health, we have heard so far that the impact of the lockdown, which was to slow down the infection but also majorly reduce the infection rate, is on track. As we speak now, at least by 17th, the results from the Ministry of Health showed that the infection rate had dropped to 8%. This is, from 40% about 3 weeks ago, which is a good thing. But we are working all these things out in a country that still has some major challenges to handle. And this is not really to highlight the country in bad light, but it's what statistics say. 8 million people in Uganda lack access to safe water. 27 million people lack access to improved sanitation facilities. And we have 22% of people living in urban areas spending about 22% of their income to access water from vendors. And Joanita, I want to hear from you. Unilever is working globally, and you're working in countries that have bigger problems than Uganda. But how do we manage to work along with these existing challenges to put across a message of hope and a campaign that will be fruitful at the end of the day?
Thank you very much. I think 3 things in that regard, in my opinion. Number 1, let's share what has worked widely, I think when the pandemic came, you can all attest to the fact that everyone thought the moment you get into ICU, you're gone.
Yeah.
But I also know people who actually survived out of ICU.
Yes.
So I think number 1, let's share as widely as we can what has worked. Because the nature of Ugandans and Africans for that matter, and many people, is I believe by seeing. Yeah? So let's try to get as positive as we can in the way we communicate to the community, in the way we communicate as media, in the way. So let's get positive, number one. Let people see that it can work. Number two, let's demonstrate on the ground. I love what AmRef has done, because we are getting to the communities, as in, if you get to the community, you've gotten to the world, essentially, yeah? So what AmRef is doing right now is what everyone should look to do. So let it go beyond, let's widen our scope as private sector, as NGOs. What is it that we need to be accountable to each other, that this is what I'm doing as Unilever, what are you doing? Yeah, because it's a joint effort. We can never sort the problems in the world. Every day we'll have a new problem. So let everyone bring their piece on board. Yeah, if I'm sorting out water, let me sort out soap. You sort out how to get the access. You sort out something. But let's take each other accountable. Yeah, because I think there are things that, and that's what, unfortunately, our communities are also getting into. Government here to Yambe. But what are you doing? Yeah. So I think there's an accountability piece from all of us individually, as communities, as stakeholders, in terms of what are we doing to sort this situation. Number three, do we think we have, whatever we have done is effective? Because there are things we do, and we do them for the sake of it. I want Unilever to be seen that I've provided soap. Yeah? Then what? Yeah? So her role becomes very important. How do we monitor and evaluate? Because we need to stop the things that are ineffective and find means of doing things that are effective. And there are very many, so we'll need a lot of initiatives and smart initiatives, because these things can be done. I'll give you an example. There's a time we ran a promotion where we dug boreholes for people in communities. And you'll be surprised how eager communities are willing to provide land where to dig the borehole and all that. So as I sit in the private sector, working in the private sector, because I'm a profit-making organization, but what is it? What are the real needs of the community? Yeah? So while we are even thinking about how we work, let's have the community in mind, and then let's see how to support each other.
Okay. Thank you very much. Joanita's words will take us for a very short break. When we return, we still have more to talk about, and we still have more people to talk to us from qualified people who have been overseeing, evaluating, and implementing a campaign to change behavior, or you call it a behavioral change campaign, to see that we stop the spread of COVID-19, or we could say reduce the spread of COVID-19 and control the rate at which the infection is spreading. So we have Dr. Luis Nyende, the District Medical Officer of Makindye Division, and we want to speak to him before we can come back to studio, so he can tell us. Dr. Kampala is still a hotspot, no doubt about that. Even, when access to information, access to water, access to many of the resources that would really be required to handle or, see that we implement a campaign like WASH to the fullest are available. What is still the challenge?
So, thank you very much, Walter. All of you, I would like to appreciate AmRef for the support they've offered to Kampala Division and Kampala District and choltera District. I speak on behalf of Makindye. Of course, we know very well that Kampala has always had a challenge because of the number of facts that one of the presenters alluded to, and that is the unique population, the informed settlements, and then the high unemployment rates, and then other aspects like Kampala has a lot of transient population. Realize that the population of Kampala during the day can go up to 6 million or 7 million, yet at night it is about 1.5 or 1.6 million. And you wonder what happens to the other 4 or 5 million. Where do they reside? So a strategy came up of including Kampala, Mukono, and Wakisa, because a number of people work in Kampala and majority reside in Mukono and Wakisa. So we had to come up with what they call Kampala Metropolitan Response, so that we have one response to cater for the greater Kampala metropolitan area. And of course, issues of social distancing, you saw arcades, Chikuo, some of the markets, it was almost impossible to do social distancing. And the reason why during this lockdown, particular places were closed, because it was hard to observe social distancing. And even those, the people who are accessing those areas would see from the media that they were not even wearing their masks. So amidst these challenges, we've been able to achieve something through the help of partners like AmRef. That you would.
About, for example, the population, day and night, is not likely going to change for the next probably 10 or 15 or even 30 plus years. Maybe it will even increase. Things like the structures where we work, the arcades, the way they were built, the location, that is definitely also not likely going to change. The facilities, the health facilities at, in Machindia where you work, the way they were built, the structures, the shape also, you know, facilitate, you know, crowding and you'd say, you know, observance of some of the SOPs would be quite difficult. But we have a situation at hand that requires us to have these SOPs implemented whether we want or we don't want, whether we have these structures or we don't have. What are you doing differently in Machindia there to ensure that we achieve what we are out for?
Thank you very much. Of course, we know some of the things are not going to change, but despite knowing that some things are hard to change, there are strategies that have been proven to work. And I would like to appreciate AmRef for helping us in those strategies. Strategies like hygiene, cough etiquette, infection prevention in the communities, appropriate waste disposal. Those are some of the things that can help, even if other things like infrastructure are not going to change. But some of these things are very simple and have been done. I would give a case study of what AmRef has been able to support. By the time AmRef joined us, we were in the first wave, and we had lots of resources, and by the time the cases were doing, and they came in handy to assist us with capacity building for the community health workers, provide for them masks, aprons, and also distribution of handwashing facilities, training of teachers in some selected schools, and provision of handwashing like soap, and also.
All right, Doctor, your internet has really become unstable. We will be able to connect to you later on. You probably could change the location of where you are. The internet is really, really unstable, but we would like to hear from you on you know, some of the responses that you have there. Let me get back to studio as we wait for the other people to join us online. And Comfort, I want to come straight to you. I'll pose the same question I asked to Joanita about implementation of some of these policies when we have some challenges at hand. You've been working in several villages or several communities in Uganda. How do we work out with some of these outstanding challenges that they look like they're not going to go away even for the next 20 plus years?
Thank you very much, Walter. Amidst the challenges, there are also opportunities. And one missed opportunity that I see in the country's response to COVID-19 is taking a purely pandemic epidemic response, because our approach to responding to COVID-19. Look at the hand washing facilities that were distributed. So these are, we focused a lot on distributing emergency response, but then we could easily strike a balance between development versus emergency. Like strike a balance between having investments that will last beyond COVID-19. For instance, if you're going to implement hand washing facilities, distribution, instead of giving these hand washing facilities that will be blown away by wind, like was a case one time, there was very strong wind around Kalere, and all of us who live in Kawempe saw hand washing facilities fly in air. So how about take a more intense investment approach, but then have hand washing facilities that are more permanent, like the ones UNICEF implements in schools. First, they are very attractive, they are permanent, and so, I mean, anything attractive will attract someone to use. Because also how attractive a hand washing facility is will determine whether I use it or not. I mean, as we promote the use of TP taps, true, this is for emergency response. But let's also strike a balance between emergency versus development. And Juanita alluded to building capacity of existing structures. We did a lot of work, especially when it came to supplying soap for emergency response. How much did we do when it came to building capacity of local structures to make their own soap? I mean, why don't we strike a balance? I know many organizations are taking that route now, but it's a very good direction to take. As you give out emergency supplies, it's also very important that we continue building capacity of existing structures to be able to respond to their own needs, even when the relief goes away. And then last but not least, everyone I think has alluded to this. This is the time to have meaningful involvement of the private sector and the communities. Communities have the capacity, they have solutions. We've seen that working with AmRef, because for us, we have no choice. We are deeply rooted in communities, that's where we exist. They have solutions, so unlocking some of those solutions will help us come up with innovative approaches that are low cost but long lasting. Like for instance, instead of thinking only doing bulk water supplies that are expensive, we could go raw catchment. And these are low cost solutions. But then we do bulk supply that in the end we're doing bulk supply but it's cheaper. But also meaningful involvement of private sector, not just waiting for private sector and telling them this, but we need to involve them in conversations for them to appreciate and want to invest. Like Jonita said, they're profit making. It's the time when we start thinking about tax holidays, tax waivers, so that the private sector comes in, puts in investment that will not only help us in the emergency, but beyond emergency.
Okay.
Thank you.
Maureen, you're in charge of monitoring and evaluating, and 1 year down the road for this campaign, we want to hear from you. What have you found to be a sustainable method, let me say, that even when this project has come to an end, the community will continue to use the knowledge that they accrued from the campaign while it was still going on, but also sustain it, you know, and be able to handle. Because if you provide a plastic water tank, for example, and it gets a hole, or it's you know, broken,
blown by wind,
yeah, or blown by wind, how then does this community continue to live if they can't afford to replace this tank? What have you found to be those small things that can be sustained?
Okay, thank you, Walter. One key strategy we adopted in this project is the clustering. We call it Umoja at AmRef. In choltera, where you group 10 households and train them how to maintain hygiene in their households. They support each other. It goes even beyond hand washing. We've seen households constructing latrines. So this Ubuntu, or the Umoja clustering we are using as a strategy, is one form of sustainability. Whether we are there or whether AmRef has left, the communities have known the basics and they're there to check on each other to make sure that they're able to do the right thing. The other strategy we used, or one key sustainability indicator, is in the training. We trained the VHTs. We taught them on the different ways, basic ways of hand washing. We gave them different methods on hand washing. So once we leave, these VHTs are going to stay within the communities and they will continue supporting the communities. Then one thing that came up within AmRef is the online system. We have the LEAP, the training system. You know, amidst COVID, we could hardly pull people in classrooms or hotels for trainings. But this is an online system that kept engaging people, training people. So it is one sustainability measure for organizations, but also government can take it on to reach out to the so many community health workers to make sure that they are trained amidst these pandemics, plus also the other situations to pass on information. It's one easier way to be adopted to pass on information. So that is one sustainability indicator, and we are actually interesting the local governments plus Ministry of Health to take it on as a sustainability measure. The other thing, we look at the sanitation facilities, because we went beyond hand washing, cough etiquette, but also to improve the entire thing. We've seen households put up drying racks within their houses to make sure that hygiene is improved, just like DHO of Chotera mentioned. Diarrhea cases have gone down within these districts. Also typhoid, but even if we left, the household knows how to use the hand wash, the rack. They know how to use the hand washing facility. So these are some of the sustainability measures we've had within this program. Thank you.
Thank you. At least I managed to reach Chotera at the time, and I saw firsthand some of these things you're talking about, the drying racks and you know, the tippy taps, both at the entry and at the latrines. Okay. Yeah, which is a good thing. I would like to hear from Dr. Luis Nyende about sanitation, because Kampala has quite a challenge there. We will be linking to him, but right now let's speak to Maggie Rarieya, the National Business Compact on COVID-19 in Kenya, and also representing the Department for International Development, commonly known as DFID. Maggie, you're welcome, and you can tell us what the situation is like for you in Kenya in the fight against COVID-19.
So good afternoon. Thank you very much for that. And it's really a scintillating conversation that we're having today. I think what I want to start with is giving you context on the public-private partnership that made this possible. So I want to talk about the National Business Compact on Coronavirus, which was founded on March 16, 2020, which is literally 3 days after the first publicly announced case of coronavirus here in Kenya. And it is a consortium of about 40 organizations. You have public facing, you have private sector, and it's basically people who came together and forged a partnership under the auspices of the Marketing Society of Kenya, but guided by the Ministry of Health. And the purpose of this coalition, and the NBCC as we call it in short, is to improve hygiene practices and contribute to protecting lives and livelihoods. So very much in line with this and with the fight against COVID. And actually the NBCC was looking at how to accelerate local action and support government efforts. And this is why the partnerships of getting the right people coming together, be it media agencies, communication agencies. In fact, the communication that was developed, that was even implemented in Uganda, came from this coalition and the building up of this. And you've talked about distributing hand washing stations. Actually, that was a lot of the initiatives. So the National Business Compact looked at driving public awareness and behavior change and distributing hygiene facilities. And that has been one of our journeys. And you know, today we see how the importance of public-private partnerships is becoming a way of sustaining. We're talking about sustaining efforts. Public-private partnerships are a great way of dealing with that. We were looking at cases of Uganda, how are people going on beyond the intervention that came in. Just let me give you a few statistics because I had you asking this earlier, Walter, in terms of how we were building up our resources. Through this collaboration, we were able to raise initially $1 million in cash and kind just locally from organizations coming together and saying, how can we play to our strengths? Do we have product? Do we have services we can provide? What can we do together? And then that enabled us to initiate a media campaign that reached over 1.8 million households and 10 million people. And then after that, we were able to actually, in collaboration with that, we were able to reach working with Ministry of Health and understanding where the hotspots, the market centers, where is it that people tend to gather. We were able to map hotspots for this disease transmission and make sure that hygiene facilities were put in there. And we're able to cover, a very good coverage of the country, about 75% of the nationally identified hotspots. And finally, what really added icing to this was through our partnership with AmRef. AmRef is a key partner. We were able to secure this DFID Unilever grant of up to £3.3 million that has been used in Kenya, Uganda, Tanzania, in order to drive this very kind of conversation that's going on now. So that is how we brought together collaboration and partnerships to do what would have been very difficult for one organization to attempt on its own. And to me, that is the key to sustaining the efforts. It needs to be joined. Thank you.
All right, thank you very much, Maggie. And still with you, I would like to hear from you about what more we can do as countries, as a region, apart from, just merely sharing statistics and a few things, having our cross-border people, like, for example, drivers tested. Uganda has taken a stance to have foreign truck drivers tested here at no cost. There was an appreciation note from the Association of Drivers in Kenya. But what more can we do as a whole region? Because COVID-19 is a multi-sectoral approach and multinational problem. So we need to handle it as a whole.
Thank you. So I think how I could look at some of these is ways that we started already engaging with some of our partners, individual partners. For example, what we were doing with hand washing stations with some of the partners is the youth were owning them, or groups were owning them, and people who had either shops or they had cafes or they had places that people wanted to visit noticed an increase in footfall in their premises when they had hand washing stations. So we're using the wash facility and capacity to try and not just reinvigorate business, but to show people that there's something in it for them by having these structures. So how can it become a point of business for them that they want to own it and they see the value of keeping such facilities because there's a trade-off for them, they gain already. On the other hand, when we started, and I talked about getting about $1 million from local, private sector and other groups that came together with us, what we first took was an unbranded approach. So we were asking people to put aside their interest in their brands and in their agenda for the greater good of, driving the behavior change campaign. While that can be done initially, in order to sustain it, business has to see what's in it for them as well. And that was the next stage of our work. We were looking at washing schools and how can we make this a branded opportunity for companies to come in and provide these facilities, but in return, they can get to show the brand, they can be made visible, they get a return on the investment. So the altruistic way is good to start work, but it is not sustainable for business partners. And so some of the ways that we can do this is create a shared interest, that a mutual interest that whether it is a shopkeeper or it is a business, a corporate, they see what they can gain from it and overall the community benefits. Thank you.
All right, thank you very much, Maggie. We will be connecting with you later on. Let me get back to studio here. Joanita, I want to hear from you. Similar question. from where you sit, how do we work together as a region to try and fight COVID-19?
Yeah, thank you very much, Walter. First of all, I love what Maggie said because she's conscious of the fact that I'm not a charity. So, and I would like to give an example that worked. When we started the Clean Ninja project, where we used to teach children how to clean their bodies and keep hygienic, because I believe that's where it will start, and that's where we have a journey to go there. We would own the canteens with Lifebuoy, yeah. And then would brand the washing stations, would, you know, do all those things. And the only thing that child would grow up knowing is Lifebuoy. Yeah. Because we believe brand equity starts from heritage. What do I know? Yeah. So I think that's a big one for us to attract partnerships, because there is no way we are going to do this by ourselves. Partnerships are key. And when you say multinational, I think we need, when we do, how do we involve the community and we get them to own sustainably. I was telling her how we wanted to do the borehole project. We would train the youth of the owner of the land, because people provide land for us to dig the borehole, and then we would train one of the sons. So we would recommend someone to actually maintain the borehole. And I can tell you those people would protect that borehole with their lives. Yeah? But when it gets a problem, he is the technician. Yeah. So how do we get the communities to rally behind this? Because I think, for me, it's what do we do to get those guys on board, the communities themselves, and get them more accountable than they are now? Because you can see that they're still crying for AmRef to go back. We cannot go back again, because now, if it was choltera this time, the next time it has to be, I don't know, Eastern, somewhere. Yeah, because everyone wants it. So how do we get the community to buy in? Yeah, so there should be something in it for them. And I think I like the fact that there's a lot more. Why did we zero down on hand washing? Because it's a lot more than COVID fighting. It fights the area. Yeah. Do they know about that? Yes, no? It fights trachoma. Just washing hands and not touching your eyes with dirty hands will save you from trachoma. Are we able to quantify that? Can we put those statistics in the face of the public and say, previously, before hand washing became a habit, these are the diarrhea patients we had. And then after hand washing became a habit, this is where we are at. They need to see what is in it for them. And that's the nature of humanity. Selfishness. What is in it for me? So can we put those statistics together and put them at the public domain?
Okay.
Yeah.
All right, Comfort, how do we have the wash policy and action transformed quickly, replicated all over?
Thank you very much. Yeah, you know, Uganda is one of those countries that has got one of the most beautiful policies and also directives. Like one of them, the president says, one safe source for the village. It's a directive that every village must have one safe source of water. But you know, policy implementation, amongst the very many things that come along with, there's one critical animal that is called funding. Like, you'll have all these beautiful policies. I know the bulk supply, the policy on bulk supply versus point water source, one safe source per village. Now, we need funding. But then government alone will not have the funding. And also, even us, the non-government organizations, we all have the funding, but there's a lot of scattered funding all over the place. There would be a lot that we can achieve when we pool resources. Let's pool resources. And of course, we will all get the branding. Not only Unilever needs the branding, by the way, Anita, AmRef too. We also need our brands. We need the world to remember AmRef. Like when we're in primary school, they used to tell us write AmRef in full. So I hope you also did, unless you studied way before us. So such as like being, if we all pull fundings and look at the common good, because we all know that we are because of these communities. So if we all, because we're going to cry funding and we shall continue crying funding because it's never going to be enough. But if government can come in and strictly push us to a direction where we, for instance, if you're in one district, focus on that district and do a good job. Instead of spreading so wide and be proud of being in so many districts, but do so little. You claim you're in 10 districts when you're actually in 10 parishes or 10 villages. So if we can pool resources and have funding focus on policy, transformation, and scale, we can do. We won't really achieve a policy scale like faster, rapidly as we think, but we need funding.
Okay. Not sure if we still have Martin on air, but if we do get him, I would like to hear his views also on how they are working this out in Kenya. But as we wait to connect to Martin and also Engineer Samuel Mutono, we have done all we have done, but we need one thing: political attention.
Yeah.
How do we draw political attention and closer coordination between the public health and WASH sectors at level of implementation? I'll start with Maureen.
Thank you, Walter. In most of the things we've been doing, we've been working with the politicians. So we bring them on board. However, there are challenges we face still as we involve the politicians. I'll give an example. The period we've implemented this project, we're in a transition phase. People are concentrating more into getting into a second term. So you realize you're working with one person who didn't cross over. So as you're working, continuing with the project, you entirely get a new person. So you need to mentor this person again. At times they come with different views. So we have challenges, but we work with them. We work with them. They are part of the team, and we implement with them.
I want to hear from Joanita. How have you managed to draw political attention from where you sit?
I think from where I sit, political attention can only be gotten when you make the people who elect them a currency. Yeah, you make them impossible. You make it impossible for them, because if we say this is where we are going, and I think it alludes to what she said. Yeah, if we are clear on what we want to do as a community, we make it a currency for political people to get on board. Yeah, so that we rally the communities behind that one thing, so that they cause the political guys to account.
Yeah.
Yeah, so make it a currency. Whatever you decide to do, you want to do water, you want to do whatever it is you want to do, make it a currency. Because right now, money is the currency. Yeah, make that point a currency.
Yeah.
And then you'll have no issues with political will. They will come aboard automatically.
Comfort, you seem to agree. How have you managed to work with them?
Yeah, I agree with Joanita. So what we've done, like there are certain things we call community conversations. That's how we get people to rally with us. So we have these community dialogues, and we always have action points where everyone wants a certain thing. But we influence the conversation. We have what we call the influencers. So when we get to those influencers, the influence conversations for everyone to agree that this is amongst all the needs that we have, this is one felt need. Now when we have this one felt need that everyone demands from these politicians, like was the case in Muru, everyone agreed with us that, okay, it's not enough to just have healthcare facilities, but we also need water in these healthcare facilities. And it became a demand. Whoever would come to us for a vote, like our health center has no water. And that helped us for these people to push during the budget conference to make sure that all the health budgets had a budget for water, sanitation and hygiene. But it came from the voices from the ground. And this came from the simple community dialogues. And this is something not new. Uganda is such a beautiful country. We've had practices that work. We used to have these things. They were called, I think, barazas. I think I wasn't born, but my mother told me, where you'd meet and you talk as a community, you agree on a common problem, and you front that. And so these are workable things. These politicians, they need these people. Trust me, that's why a politician is confident enough to tell someone, if you vote me, I'll make sure this health inspector that is making you construct latrines get transferred. Such a ridiculous statement coming from a politician, because that's what the community wants.
And going forward, what do you think should be the way out for these governments? COVID-19, has really brought us together, globally. But what should be the way out? Where should our priorities be, in terms of funding, planning, investment?
Thank you very much. It's like asking a child to pick between a piece of cassava and candy. The child will pick candy. Because not only have I been in the WASH world for the past 15 years.
Yeah.
There's enough evidence that when you provide access to water, sanitation, and then give people information to practice, to put in place the correct hygiene practices, there'll be reduction in diseases. We all want to go to the middle income status, especially in our country. But you'll not go to a middle income status to the sick community. We know their role division, especially in our country, where women and girls have the sole responsibility of looking for water in most cases in many parts of Uganda. But if you still have 28% of girls missing classes just because they had their menstrual period and because the person who designed the classroom forgot to put a wash facility for this girl in this school, then we might add ourselves more years to reaching the middle income status. It might not be 2040. If you still have women carry water on their heads, and you think our heads were designed to carry water, as opposed to thinking and planning for our country, let's add ourselves another 40 years to reach middle income 2040. Then, last but not least, we know that things do not happen in silos. Even if we say that, okay, we're going to put all the water, but if we do not think about other sectors, so it's the time that we need to do system thinking. You're not going to think about just water, sanitation, and hygiene. You're not going to think about and leave other aspects in hanging out. So we need to think, it's system thinking. Think infrastructure, human resource. Think about financing. Think about like the community. We have turned our communities into beneficiaries as opposed to looking at communities as partners. I mean, if you make me a beneficiary, you give me room to be vulnerable. And when I'm vulnerable, I might lose my sense of thinking, that I won't even be able to do the simplest things that would help me reach Vision 2040. So, in conclusion, the investment should go towards water, sanitation, and hygiene. I work for water, sanitation, and hygiene, but there's evidence why. Because not only do we, it's not only is it a human right, will improve education outcomes, health outcomes, but also even agriculture, production, and all other aspects that need money, need water.
Okay. Thank you very much. At this point, let's connect to Dr. Engineer Samuel Mutono from the Advisory Council of AmRef Health Africa. Doctor, you're welcome, and we are glad that you managed to make time to connect with us. We have been discussing in these final minutes relationships with the government. How do we link the two? I would like to hear from you on, first of all, how these policies that we come up with can quickly be implemented, but also to draw attention from the government.
Thank you very much. Apologies, just joining this late. But linking with the government, fortunately, the government of Uganda has been well structured, especially the wash sector. We have forums where interaction takes place with the government officials. WASH, the most active Ministry of Health, Ministry of Water, Ministry of Education. We have with NGOs, for example, there is a National Sanitation Working Group which pulls together stakeholders together, and that is a forum which can be used to share information and to lobby, to help in lobbying. And also at the central government, I know now we have turned into programmatic approach, no longer sector-wide approach. But there used to be a sector working group where NGOs could be represented. We are fortunate we have the Uganda Water and Sanitation NGO network, and it was set up partly also to help in advocating policy, but having a joint voice of NGOs working together and lobbying government. And they have been attending all these sector meetings so that they have input. And also I attend together with some of the big influential NGOs, not entirely alone. So the sector has been structured well, and there are chances of how the various stakeholders can influence the policy. I don't know whether that adequately addresses your concern.
Yes, it does, Doctor. Finally, from you, in just about a minute, what is your call to action to government?
The call in government?
Yes.
We have a challenge with the government, especially concerning WASH and concerning the software things, behavior change, for example. It is not easy to convince the government to put resources in the software activity. They would wish to see hardware, something you can go and show. But when it comes to software activities, such as running campaigns, it can be a challenge. I've been in this game for quite some time. I know around 2007, together with Unilever International and the London School of Hygiene, with the World Bank, we came up with a national strategy, national hand washing campaign strategy. But implementation is a challenge because the resources are not there, especially to take it to scale. And that is one of the challenges we have with government, how we can convince government to invest in these soft aspects, which are important for behavior change and also for sustainability. And in fact, we've been attempting, but we continue to call upon the media, because some of these things, when they appear in media, often some people in government can take them seriously. We need to partner together. I've heard the private sector mentioned for sustainability, but that is the biggest challenge. When they wonder what is hand washing, what do you have to campaign? Yeah? The structures can, the LCs and so on, and leaders can do that, but yet it is much more complicated than that. I think that's where we need to work harder, using some of these, like COVID, for example, to promote the hand washing with soap. But when you look at how much resources government is putting in the hand washing campaign compared to hardware things, is also limited. So with the government, that is where we have a challenge, appreciating that these soft are important for behavior change and therefore getting the benefits that we need to get from water, sanitation, and hygiene facilities that we may install.
Okay.
Thank you.
Finally, and to the donors, what do you think about the donors?
The donors, normally in Uganda has been fairly well advanced with preparing sector investment plans and so on, such that the donors can go and plug into what the government has planned. Some of the plans don't have resources, so we need to appeal to donors, but also sometimes, of course, the government does not appreciate. Perhaps the donors might appreciate more, but it is a dilemma, because when you take like the World Bank, the money belongs to government, so it's the government to decide on what they invest in. Although the donors might have appreciation of these soft activities, the government may say, none of this money we have borrowed will go into these workshops or campaigns and so on. We want hardware only. And yet the government does not put money of itself in its own money into these soft activities. Perhaps what I would encourage the donors to work with the NGOs, civil society organizations, with the media, facilitate the private sector to make sure that some of these software things can be covered, especially investing in NGOs. I know there was one time of recent when there was a decline of resources going to NGOs, but for behavior change for the soft spots, I think donors need to consider seriously channeling the money through NGOs, if their mechanism can allow.
Okay. All right. Thank you very much, Dr. Samuel Mutono. He's a member of the Advisory Council at AmRef Health Africa. We're going to use the next few minutes, about 5, to answer some few questions that have been coming in. And Joseph Mubiru, who works in Choltera, wants to know from Comfort, how can we synergize the efforts for washing hands in Choltera district? He says he works with USHA, but also he wants you to share some data on hand washing in sub-counties in Choltera.
Thank you very much. I actually know Joseph Mubiru. He was my colleague when I worked in Ministry of Water and Environment. So, you know, like my colleagues and the district water officer already alluded to, in Choltera, we already have structures that we put up in place. We have the household cluster heads, we have the village health team members that were trained, and we also have the existing clusters. We have these clusters that still exist. So there's no better way to carry on what we had, but to continue building, to continue relying and leveraging on the village health teams and the village health teams, the cluster heads. But then importantly, you know, one thing that works in one area may not work in another area. So being contexts, looking at similar contexts, there can be a very good synergy of what happened, like, because we can do the same thing in other places, but paying very close attention to the context. One shoe size might not fit all.
Okay, all right.
Then for the statistics, my colleague has the statistics in Choltera.
And I don't know if you're not ready with the statistics right now, probably we can give them a website where they can access them.
Yes, we can give them a website where they can access them.
Yeah, and we have another question here, and this one is from Kawempe. He says, are there plans for AmRef to join hands with government on vaccination in the long-term care for facilities? And this also cuts across. I want to hear if Unilever has such a plan.
Yeah. So I think, and I think just to go back to a little question that you asked, how do we get, what do we do going forward? And I think I would like to echo this, and I would like to look at the camera and tell government and everyone who is behind this to think prevention.
Yeah.
Think prevention in everything we do. Yeah. And I think that alludes to the vaccination piece. Yeah. I know government has been trying to get vaccination, but I think we have an opportunity to partner together, because in the different sectors, especially the global space, we have an opportunity to actually work together with these spaces and use our muscle as private sector to get some of these things. So I think we have an opportunity to partner with government. Let them speak to us. Let's sit on a round table and see. We have different muscles differently, so let's see what muscles we can pull in that space. But yes, there's an opportunity, much more.
Okay. Is that the same for AmRef?
Yeah, we have plans to support government efforts in the vaccination. We're already doing this, you know, even under the HBCC. Even because there was a lot of myth around the vaccine, there was a lot of misinformation. So we're already doing this, though we're not giving out vaccines, but we were using our village health team members to try and break some of the myths and misconception about the vaccine. Because if I can give you information about the vaccine, I'm still supporting the vaccination process. But we're also looking for funding. We have something in the pipeline that will complement government efforts in Kampala and also other cities that are at very high risk.
Okay. Priska from Chenjojo says, WASH in the city should start with proper infrastructure development and proper fiscal planning, which partners can advocate for.
Yeah.
Correct.
Okay. All right. So the questions are really many, but we hope that these people have also been sharing them on social media. At least the AmRef handle has been very active. You can get some responses from there, and if you can access their website also, all these statistics that have been shared here are uploaded there. You can always find these reports. I want to take your parting shots, starting with you, Maureen.
Thank you, Walter. I want to take this moment to thank our partners who have really supported in the implementation of this project. I want to thank Unilever and DFID that have supported. This project has really created change in the communities. It has really helped people. The numbers would have been higher than this, but it has had an impact within the communities, thanks to the donor. Then to the VHTs, these are food soldiers. They've really done a great job. We are really happy with what they're doing, and the success of this project are really attributed to the VHTs and the district local government that we've really partnered with. Thank you so much.
Okay, maybe just before you cut in, Martha Naigaga has finally managed to connect with us, and she is the national coordinator at AmRef, yes, for sanitation. Martha, thank you for joining with us. We have about 3 minutes for you, and we would like to hear from where you sit. What is the program like for the past 1 year? What have you established, and what do you think should be implemented going forward?
Thank you very much. I'd like to make a small correction. I do not work with AmRef Africa. I work with the Ministry of Water and Environment. So I will speak from the perspective of government. I would like to mention that as government, we do appreciate the efforts of such organizations like AmRef Health Africa and the partnerships that be. For example, the one that they have been having with Unilever and DFID and all these other partners in this effort to combat COVID-19, but also in all other WASH-related interventions out there in the districts. So as a country, we have registered improvement generally in access to hand washing, although we would have loved to see bigger strides. And I want to thank the contribution of such efforts. For example, the one we have been having in Choltera and Kampala. These being hotspots, these have been very welcome. And I would say they have contributed to the increase in access to hand washing in the country. As of last year, we were able to register a 61.1% access in urban areas and about 38% in rural areas. I would have thought that this should have been a little higher, given that we have been battling COVID-19 and hand washing has been highlighted as a key intervention in the prevention of COVID-19. Unfortunately, we must all appreciate that these are all behavior change issues. Like I was hearing earlier, people mentioning about masking, social distancing, and also hand washing. You realize that all these are behaviors that must change. And we all know that this takes a bit of time. There was a bit of scare when COVID had just started and we saw the rates go really high, but people got used to the disease and eventually stagnated. But we want to urge the rest of partners and as government, we want to continue with the effort to raise awareness about this disease, but also about the benefits of hand washing just beyond such campaigns that are tied to diseases. We have been at this business for quite some time of promoting hand washing. We do have a hand washing initiative in this country. It is currently hosted at the Ministry of Water and Environment, and it is made up of partners from Ministry of Water, Ministry of Health, generally government partners, but also civil society organizations. So I will say that we're not going to back down. We will continue as government to provide the space where every player can continue to make an effort and contribute to the overall improvement of hand washing in this country, and also in the fight against COVID-19. I will urge that we must consider issues of sustainability. Even when we have our figures going towards 100%, I will say that it is important that we consider sustainability And I would like to appreciate the effort of AmRef at this rate because they worked with existing structures. That's one way in which to achieve sustainability in the district, that they didn't go and, for example, start to create their own structures, but they worked with the people they found, the government structures that exist in Choltera and in Kampala. They worked with the VHTs, they worked with the district health office and the extension workers, and these they will leave behind even at the end of this project. So we believe it is an effort that will work towards sustainability. We cannot underrate the presence of private sector actors like Unilever in this campaign. We are very glad because these are the people that complete the loop, really. They're the ones in charge of developing products and technology and tools and all these goods that we need and use in these efforts of WASH promotion. So having the private sector with us is very key, and I will urge that this partnership is strengthened even further. Lastly, I will talk about the issue of scale. This project was in 2 districts, but I would urge that we continue to cover the district and cover it entirely. Like one panelist mentioned earlier, it is not right for us to go and intervene in only a small pocket, and we count that we are in that district and we're not reaching everyone. We are in the era where we are looking at leaving no one behind, where we are aiming for universal access to WASH services. So I will urge our partners out there that when you choose to intervene, please ensure that you are at scale as much as possible. Lastly, I would like to thank all of you for considering it important to work with government and inviting us to this forum where we can share our views. As government, we're experiencing challenges with funding and all that, but I am sure if all of us pull our resources together, we can achieve the necessary synergistic energy that we need to push us forward and propel us towards universal access to WASH services in all our communities. Thank you so much.
Okay, Martha, in just 1 minute, how is government solving the challenges of access to water?
Thank you very much. Government is doing quite a number of efforts despite of the challenges that we're experiencing in terms of financing. Government is increasing access to safe water in areas, in rural areas, and also in urban areas. As of last year, we were able to register access figures of 68% in rural areas and about 76 in urban areas. This is not yet where we want, because according also to that same report that we compiled for last year's sector performance report, only about 68% of the villages in this country have access to at least a water source. That's not where we want to go yet. We are just on our way and we still have a huge gap ahead of us. But with respect to COVID, the intervention government has done for now through our utilities that manage water supply in the respective areas, including national water and also the umbrella water and sanitation organizations in the respective regions. Water is not being disconnected in this period of COVID because it is a key ingredient in the fight of COVID to enable people to wash their hands.
Okay,
but going back to the question.
Thank you very much for that. Our time is really fast spent. We can't go past this, but we do thank you for joining us and telling us what government is doing. We will probably continue this conversation online for all of you who managed to join us for the live show on TV, but also those who have been giving contributions through the mobile here and on Twitter. Continue the conversation. The hashtag is WashFest. I want to thank all my panelists, those that have been online, and the ladies here in studio. Thank you for coming. Our time is really fast spent. My name is Walter Mwesije. We will now transition to normal programming. The Beat is coming up, and stay tuned. Good evening.